Hi, George. It's so nice to see you.
It's wonderful to see you again, Amy.
You have been such a wonderful voice for patients. I'm wondering if you can share with us how you became a patient advocate.
Okay. Well, I spent a great deal of time over the last 21 years in treatment for my leukemia. And one day I was sitting there and I thought, what am I doing for the next generation of people who are being diagnosed with leukemia as I sat there? Young people, old people, children and so forth. And I thought, I've got skills through my 40 years of business. I've got skills of being able to communicate things, and maybe I can take those skills and use them to advocate for predictable drug costs, for access to medicine for all, not just leukemia, people dealing with leukemia, but for all people who are dealing with chronic illnesses.
And we are so grateful that you are advocating on behalf of yourself and so many patients, particularly as it relates to the Medicare reforms. How do you advocate? What are the ways that you advocate?
That's a very good question, Amy. I actually started advocating during my treatment. I realized when I was being treated, the doctor doesn't talk to the pharmacist all the time. The pharmacist doesn't talk to the insurance company all the time. The people that produce the drugs don't always ship the drugs. They don't interact with the shipper. So I realized that I had to advocate on my own behalf to get the level of service I needed to keep my outcome successful. So I've been advocating other things for a period of time, and I just thought, well, why can't I take those and bridge those into advocating for the bigger challenge that we all face.
So how do you do that? So in addition to raising your voice with your individual healthcare provider and your pharmacists, et cetera, how do you bring that to a new level for all people on Medicare?
And again, a wonderful question. I worked for a company that was based in India, and they had an expression that said, it's like eating an elephant, you have to eat it one bite at a time. So the first thing I realized was that making change in this space is an enormous task, and don't try to accomplish the whole task at one time. Figure out what little bite that you could take on to move the thing forward. So the first step to any type of advocacy is establishing the scope of what you think you can get done over what period of time. Once you've done that, then you have to understand the landscape of who owns it, how are decisions made, who's responsible, what is the cost implications, and in some cases, what are the political implications of what you're trying to get done.
So we have, at the PAN Foundation, we've been advocating for Medicare reforms for many, many years. And we were so happy to see this past August 2022, through the Inflation Reduction Act, that some key Medicare reforms were enacted. A Medicare Part D cap of $2,000 taking effect in 2025, and the option to more evenly distribute those costs throughout the benefit year. How did you feel about those reforms passing? When you heard that news, how did you feel as a patient?
I'll tell you my initial impression. I wish I had a balloon, okay? If you take a balloon and you squeeze it, all the air goes to the top, okay? Basically what they did with the Inflation Reduction Act was they squeezed the top of the balloon and all the air went down to the bottom. But it's still there. It's still the balloon. It's still full with all the same stuff, the same cost components of the manufacturing of drugs and products and services and things, and the insurance and the government's role and all that. All those things are still there. There's no clear understanding of what of those things are going away or changing as a result of the act. All I know is that what was up here is now down here.
Do you feel that Medicare Part D cap and the option to smooth out those costs, are those reforms good for patients?
I believe they are. I believe that any change whatsoever in the cost of medicine downward is a positive, because every patient is different. So you'll see some patients where it'll make an enormous difference in their lives to have that cap. Some other patients it may be very little. I'll give you an example. Today, the bulk of my out-of-pocket for drugs, just drugs, is I'm getting a tremendous amount of assistance from PAN, from my PAN grant, okay? If the PAN grant went away, okay, because they're paying the bulk of it, if the PAN grant goes away, my costs would go up by $2,000, not down. It would go up by $2,000 because what's being covered by PAN today, my biggest piece of medicine is being covered by PAN, and if that help goes away, then I pick up whatever cost it is, which in this case would be $2,000. So January 2025, my cost goes up $2,000 without any assistance.
So I think I know the answer to this question, but I'm going to ask it anyway. Does the Medicare Part D cap and the option to smooth out those costs solve the issues around access for patients? No, because the key word that I heard was access. Access to me says, this is the drug the doctor wants me to take. I believe it's a good drug for a treatment outcome as well as a quality of life. And when you say access, what you're saying is I would still be able to get that drug. So that's the key. I know that the act will reduce the cost of some drugs, but I have no view that the particular drug that I need access to will be available in 2025. Right. Still a lot of unanswered questions with the Inflation Reduction Act, for sure.
Yes.
If you were speaking to a member of Congress today about the Inflation Reduction Act and the Medicare reforms, what would be the key message you'd want to say to them?
That's great. That's a great question. So I would say to all the representatives, not just the ones in the great state of Texas, I would say to all of them, you've done a tremendous thing in taking the first step, okay? But don't stop there. There's a lot more work that needs to be done for all Americans, because we're all in this together, okay? I would say don't stop there. We still need to understand that people are not pills, they're people, and people have tremendous amount of needs and requirements, and you've tackled one, and hopefully that actually helps some people. I think it will, but let's not ignore the other ones. Let's keep the momentum that we've established going.
I've heard a lot of people talk to me about the total cost of care, that it's not just the cost of prescription medications. There's a lot more that goes into one's care. Can you talk a little bit about that from your perspective?
Sure. For my own personal perspective, my total cost includes premiums, deductibles associated with those premiums, over-the-counter medications that are not covered by my insurance, which happens to be Medicare, appliances that my doctor may require, watches, heart monitors, those types of things, which are not covered also by Medicare. There are drugs that I need for my treatment, as well as my wife for her medical treatments, that are not part of Medicare's formulary list. That's the list of drugs that Medicare says these are in scope. If it's not on this list, they're out of scope. You pay 100% of that cost. And so those would certainly fall into that category. Dental and vision. Dental, the cost of dental, even basic, x-rays and cleaning and those types of things, all of that's going up. And there's no real coverage for that anywhere. I shouldn't say the marketplace there's coverage, but it's very, very expensive.
Right, and at the Pan Foundation, we've long advocated for Medicare to cover dental, vision, and hearing services. It's so important for people on Medicare.
Yes.
How does access to the medications you need improve your overall quality of life?
That's great. So if I have access to the drugs that my doctor and I feel I need, and let's talk about how that decision is made. The doctor says, George, you need a drug to sustain your life and have some sort of a better outcome, okay? So I say to the doctor, what are the side effects of that drug? What is the requirement for taking that drug? Do I have to, take it and lay down for 2 hours? Do I have to take it and avoid eating? There's all these different things around all drugs, and so I have to understand exactly what that drug does. And then I take those requirements and I overlay them into my desired quality of life. If I have to take that drug on Wednesday and I'm useless on Tuesday, well, that just shoots all my Tuesdays, and maybe I go work out on Tuesday. So there's different things, feedback that I would give the doctor to say, love the drug, but it doesn't work for me for my desired quality of life. My doctor would tell you, because I've asked this question, George, that your quality of life is the most important thing. He sees, George, your outcome is going to be what it is. I don't care what condition you have, what treatment you get. Start here, and we get there, and 9 out of 10 people will have a similar outcome. What you and I can change, what you and I can work on is, what is your life like during that period of time?
And your doctor is right. That is the most important thing. If you were speaking to a group of patients today, what would you tell them about the importance of engaging in this advocacy work?
I would tell them I would tell them that when you are initially diagnosed, it's like a fire hose, hitting your face with all these things that you didn't know were going to happen, and things, how do I tell my family, and how do I tell my boss at work, and how do I manage my job, and all these other things. You can't avoid that. You have to go through that. There's lots of support out there for that. You don't have to do that alone. Understand there's lots of support, but once you get through that phase, then you need to start saying, okay, I own this. This is my illness, and I own how I get treated. I own where I get treated. I own who provides the treatment. I own what insurance companies are going to support me. I own the pharmacy that I'm going to go to get the medicine. So you own all of those things. Don't hand that off to someone and hope they're doing a good job. Don't hand your care off to a doctor or a facility that you don't have 110% confidence in. What I did, I put together a list of 10 questions, and I said to any doctor, I don't care whether it's the doctor that's treating me for my leukemia or one of my other doctors, I put together a list of questions. What's wrong with me? And how did you come up with that? That's question one. What are the treatment options? And don't tell me there's one option. Tell me what the treatment options, plural, are, okay? And then talk to me about each individual option. See, these are the things that you do to start taking ownership of your treatment. Where will my treatment take place? Oh, really? I have to drive into, downtown somewhere 50 miles from here? No, that won't work for me and my quality of life. So you walk through these lists, and I have a list of 10, but you can make your own list up, but things that allow you to say, I own what's happening to me, and who treats me, and where I get treated, and I own the insurance company. I had a choice of insurance companies, and I selected them based on where they were from a technology standpoint. Could I go on the internet, or do I have to call some 800 customer service number? There's a whole bunch of different decisions that make for my quality of life. Can I get an answer at midnight?
Very important.
Because when I'm sick, I want an answer at midnight, and that goes all the way up the chain. If I can't reach my doctor at midnight, that is not my doctor. Okay?
So when it comes to a patient raising their voice to help drive legislative change or regulatory change to improve our healthcare system and improve access to care, I've heard patients say, I'm just one voice, what, is it really going to make a difference? What would you say to them?
I would say that, and I've actually talked to legislators in the past. I believe they listen. I believe they listen. I believe that they are faced with enormous challenges to get change made, but I do believe they listen, and it depends on the number of voices, right? So they're listening, and all of us, me as an individual, I can write my legislator tonight. I can sit down and send them, and some of them I can actually call. But if I'm doing it, and it's George times 1,000, George times 1,000,000, the voice becomes so overwhelming that the legislator has no choice, they have to act. That's the way our system works.
George, I want to